Hi, I'm Dr. David. I want to talk to you about chemotherapy and cancer treatments. So obviously chemotherapy is probably the most common approach to treatment of cancers of all kinds, for breast cancer especially. There are surgical approaches and radiotherapy, radiation therapy as well. But chemotherapy is the mainstay. And what we now know is that long-term effects of chemotherapy include brain damage, include brain fog, and you just need to be aware of it. It's not that I'm not saying that you should not have chemotherapy for that reason. As you know, I started my practice, my career as a radiation oncologist in training, but chemotherapy can be very, very toxic to all kinds of cells in the body, including the immune system, and as I've mentioned, the brain. So what you do need to know is what to do during, before, and after treatment to ensure that your brain is preserved as well as the other organs in the body. Now, doctors will say that there's nothing you can do. That is simply not true. With all due respect to oncologists and radiation therapists everywhere, it is not true. There are things that you can do that actually not only will they not interfere with the treatment, but they will also potentiate the effects of the treatment so you come out unscathed. And we have a lot of that information on our website. You can reach out to us, and we'll be glad to point you in the right direction. But yes, there's something you can do. By the way, before I wrap this one up, they're looking at COVID brain fog. You've probably heard of long haulers by now. People who have had many times mild infections, many times happening more in women, like 70% more in women, where they had a mild infection with COVID. They recovered from the COVID infection, but they began to see all kinds of sequelae, side effects of the virus itself, everything from problems with taste and smell, to problems walking, to problems keeping their balance, and of course, brain fog, inability to remember things. Some are even complaining about emotional labilness, I believe that's the right word, when the emotions are up and down. You know, just 1 minute they're okay, the other minute they're crying. I actually had a grown man cry over the phone when we're talking about this issue. So it's a big problem. And we're now seeing that it can actually lead to, get this, can actually lead to Alzheimer's disease. They're seeing a higher risk and higher incidence of Alzheimer's disease among those who have suffered from COVID-19. So this is no laughing matter. And so we need to do what it takes to protect our brains, since we at BBF are the sworn enemies of anything that affects your ability to think, to learn, and to remember. We are going to continue to attack and address this as much as we possibly can. So there you go. Chemotherapy, doing breast cancer treatments, you've got to include the mitigating factors. And of course, that includes nutritional supplementation like vitamin D3. Don't let anybody tell you otherwise. All right? Got it? Take care.